Hi, I'm Dr. Robert LaBelle. Today we're going to be going through lumbar pelvic stretching. So we're going to be stretching the hips out and some of the leg and some of the low back musculature. Initially we'll start with what we call a lumbar twist. So Ariane is laying on her back, and typically she could be on a couch or a bed, and this would work well. So we're going to be stretching the right low back. So what we'll have you do is bring up your right leg, then you fold it over. If you're on a couch or a bed, you'll have to grab on and make sure that you don't fall over and support yourself. You'll notice that Ariana's upper back is flat against the floor and that her hip is turned over. What we're trying to accomplish is a stretch through the low back area right in here. Very often we can get a stretch in the hip because the hip is so tight, and it's a limiting factor in this exercise. So in that regard, what we suggest is changing positions of the knee in relationship to the chest. So if you pull your knee up towards your chest, that can bring the stretch up into the low back. Ultimately, in this position, you'll spend about a minute and you'll stretch approximately 3 to 5 minutes on both sides. Spend a minute. After the minute's up, bring your leg back, Ariana. Sort of shake out your low back and your hip, get some of the discomfort out, and the next minute you would just go straight back into that stretch. We don't want you to be stretching into any pain here, just a mild amount of discomfort would be good. Like I said, you'd be doing it on both sides. Good. We come out of this. If you stay laying on your back, the next stretch we're going to go through is a hip and glute stretch. With her right hand, she's going to grab her right knee, and with her left hand, she's going to grab her left ankle. I don't want you grabbing at the foot because you'll be twisting at the ankle joint. If the knee, you can keep the knee up at a reasonably 90-degree range of motion like this, and what we're doing is we're going to be stretching the glute in 3 different angles. She'll pull the knee right up to her chest. This is your torque and how you can get a little bit better of a stretch if she pulls with her left hand. It's a pretty decent stretch there. You'll hold that one for 30 seconds or a minute, and then you would move to the next angle, and you can hold that for 30 seconds to a minute. Again, we don't want you to be stretching to too much discomfort. Just into pain is good. And the last one, you bring it over your body, just like that. During this exercise, patients have a tendency to raise the hip off the mat. It's very important to use your core muscle and pull that down, and that will augment the stretch considerably. There's an alternative to this stretch, if we have you come up, Ariana, which we call Pigeon Pose. It comes from yoga stretching. And this involves less arm motion. Very often people's arms will get quite sore stretching or fatigued. So in this position, Ariana's leg is folded under. She has a decent knee bend. The closer it is to 90 degrees, the harder the stretch. So we can start off initially with a pretty reasonable knee bend. And what she does here is she just leans forward into a stretch. And what we're stretching is the right hip back here. You would hold that once again for 30 to 60 seconds. You can rest on your elbows like she's done to get a really decent stretch. If we come up a little bit, Ariana. One thing that we teach all patients here is to do 3-dimensional stretching, and you want to think of a clock, and Ariana's leg is pointed to 12 o'clock. If we bring Ariana's leg over to Ariana's 11 o'clock and then come forward, she's going to get a little bit different of a stretch, and it's going to be felt in a different fiber in the hip. And likewise, we want to bring it over a little bit more and get into a decent stretch. In this position, the tension in the hip will start pulling the low back this way. You have to be cognizant of actually taking a little bit of a twist in the low back to getting a bit more of a stretch to the hip muscle. That looks good. The third stretch we're going to go over today is the hip flexor stretch. This is an old school runner's or lunge stretch. We do it a bit differently now. Ariane is in a good position here. Her left leg and her right leg are aligned quite well. What we want her to do is she wants to pelvic tilt a little bit. Bring your belly button towards the back of your spine and then bring the chest back a bit. And if you put your right hand on your hip, what we're going to do is just sort of lean forward into the stretch until we feel a gentle pull in the front of the groin or down the quadriceps muscle. All these stretches you're going to hold for 30 to 60 seconds. We don't want too much discomfort, just a mild pull. We're going to do different angles like we did with the glute and the hip. So initially what Ariane is going to do is take her right foot and move it outside, just like that. It's a bit goofy, this one. And then lean forward again. And now the stretch has moved from the front to the outside. We can actually bend to the left a little bit, and that can help augment that stretch there. That looks good. Okay, the other modified stretches for this is to continually bring your leg back in sort of a clockwise sort of motion. And she'll end all the way to here, and then you lean forward. And this is now not stretching the hip flexor so much as it's stretching the groin muscle. So she'll end up doing a couple different angles here. And that'll give a three-dimensional stretch to the entire hip. A bit more of an advanced hip flexor technique is to go straight on again. Get into the same stretch, pelvic tilt, chest is back, lean into you have a good stretch. Take your right hand, raise it up, fingers as high as possible to the floor. What this has done is it's elevated this, and what you do is you bend gently to the left, and then you bring this shoulder back. This will pull the hip flexor stretch up into the lower abdomen as well. You may get a little bit of a pinch to the right low back. If it's not too sore, ignore it a little bit, because what this is doing is it's putting a little bit of a torque to the low back. If the low back pain is quite sore, then back out of it, and we'll talk about it at your next appointment. Like all the other stretches, hold for 30 to 60 seconds, and it is important at times to play with different angles, bending further to the left and bringing this right shoulder back, just like that. These three stretches are a great pelvic and low back flexibility procedure. We deal with the low back stretching, the glute, which leads into the low back, and the hip flexor, which actually has attachments into the low back. These three stretches done regularly should keep the low back flexible and moving, and will be done well. A good stretching program would be doing the right side for a minute, then the left side, moving to the glute, doing the right, then the left, the low back, right and left, and cycling through that program. It can be done 2 to 4 times a day, each stretch holding for about a minute. And stretching, which is a bit different than ball work, can be done daily as long as you're not stretching too hard.